guys. Saan ba yun? Oh. Sa Erin lang natin hanggang 7 o'clock, guys. Alright? When, pag 7 naman, mag-ano na tayo. We will call it a day. Right? So at least man lang, meron tayong patikim. Ay, kasi patikim. Alright. Sige. Okay, wait lang guys ha. Minom sa pagtubig guys. All right. Okay, HIV/AIDS Dissidents Highway. All right. So, what is AIDS? Acquired immunodeficiency syndrome. It is caused by a human immunodeficiency virus. Usually transmitted lang po siya through blood products, semen, vaginal fluid, and breast milk. Okay. Diagnosed by enzyme-linked immunosorbent assay, or what we call ELISA. And it is confirmed by Western blot test. Right? Yan. Okay, so what are the symptoms of AIDS? So there would be extreme weakness and fatigue, no? Rapid weight loss, frequent fevers with no explanation, heavy sweating at night, swollen lymph glands, minor infections that cause skin rashes and mouth, genital and anal sores, white spots in the mouth or throat, that is your oral thrush, and chronic diarrhea. No, unexplained din po siya. A cough that won't go away, sira siya ubo-ubo, no? Short-term memory loss. Okay. Answer, fact or fiction? You can get AIDS from a mosquito bite. Anyone?
Fiction, ma'am.
Okay, it's a fiction. HIV is not transmitted by insects. All right. Next, you can get AIDS by having oral sex with an infected person.
Fact po.
Fact or fiction?
Fact po.
Correct. It's a fact. Any type of sexual activity where bodily fluids are exchanged with an infected person is a risk of HIV transmission. Our mouth is covered with membranes, right? Membranes have nerve endings. So, oral sex is a form of one type of tinatawag natin na sex because we have vaginal sex, anal sex, and the third is the oral sex. So all of those structures are covered with mucous membrane. So, pag involve ang bodily fluids, so the person can get infected. Lalo na pag may sira ang ngipin mo, naturally, no? You can get infected with AIDS. Dali lang kayo may chat. Okay. All right. Next. HIV survives well in the environment. So you can get it from toilet seats and doorknobs. Fact
Fiction.
or fiction? Yes?
Fiction.
Correct. It's a fiction. Scientists and medical authorities agree that HIV does not survive well in the environment. So forget about those toilet seats. But flush kayo muna before kayo magwiwi. Alright? Flush lang good and wipe the seats. Okay? Meron naman din tayong pabili. You have your alcohol with you. So, better spray before you sit if you're going to sit. Alright? Next, you can get AIDS by hugging a person with HIV who is sweating. Fact or fiction?
Fiction.
Fiction.
Correct. It's a fiction. Contact with saliva, tears, or sweat has never been shown to result in transmission of HIV. Right? Next, you can get AIDS by kissing someone who is HIV infected.
Fact po.
So, fact?
Fiction.
Fact po.
All right. Kung saka nga kiss, nga naman nga fact. All right. So, depende if may laway, ma'am. All right. So, here is the answer. Okay? It is a fiction. All right? It could be extremely unlikely to get HIV from kissing. Even open mouth deep kissing, no? Hindi po nakukuha sa HIV. HIV is transmitted through blood, semen, vaginal fluids, and breast milk. And these fluids are not usually present during kissing. All right? Saliva, you cannot get HIV from saliva. It is naturally produced by our mouth, right? All right. Condoms aren't really effective in preventing HIV transmission.
Fact po.
Ano yon?
Fact po.
Fact. Okay, tingnan natin.
Ay, fiction pala, ma'am. Wala ko ba sa
Okay,
Aret? Natin
fiction.
Aret,
So,
ma'am.
condoms aren't really effective in preventing HIV transmission. Okay, it's a fiction daw, guys. Studies have found that even with repeated sexual contact, 98 to 100% of those people who used latex condoms correctly and consistently did not become infected. All right, we have to deal with correctly and consistently and how you keep your latex condom. All right, that would really affect now whether it would be fact or fiction. If your condom uh, is not placed in a secure place, like your wallet, men's wallet, because latex can be brittle, no? When it is exposed to heat. Okay. O nya ka na imong mga wallet, gibutang nimo sa inyong lubot. So, init na siya. So, it is no longer effective as preventing HIV transmission. Remember, the condoms has micro holes. Okay? Our HIV is like a pinpoint ng ballpen kalaki. Okay. it can fit that micro holes if your condom is brittle. Alright? Kaya nga sinasabi dito, correctly and consistently. Alright? So, condoms should not be placed inside the wallet. Alright? How will you know na infected na ang person ng AIDS? You can never tell the person, hoy, HIV positive ka. Hoy, naka-AIDS. You can never tell until the person would submit herself or himself for an ELISA test and confirm it with Western blot test. Alright? Dili gina nimo mailhan ang tao nga naay AIDS. Normal looking person lang na siya. Until such time na ma-hospitalize din siya, then the doctor would doubt, oops, kailangan natin siya ipa-ELISA. And that would be the time na malalaman ngayon na HIV positive siya. Okay, for those persons who have multiple partners, would see to it that they submit at least man lang, no, once a year themselves for an ELISA test. Kasi you can never tell a person who is infected with HIV. Alright? Carrier lang siya always. But any phase, mapunta tayo dyan, any phase ng HIV, lahat yun, infectious talaga ang individual. Alright? Sige. Sige tayo. Okay. There is a connection between other STDs and HIV infection. Fact or fiction? Guys,
Fact, ma'am.
correct. So, there is always a connection because HIV infection is considered as a sexually transmitted infection. All right? Having a sexually transmitted disease can increase a person's risk of becoming infected with HIV up to 10 times. Okay? Kambal na po yan sila. Okay. Sige, nasagot ko na pala. Alright? So, yeah. Okay. So, how a healthy immune system works. So, we have here physical barriers, innate immune system, and acquired immune system. Okay, ang physical barriers natin, guys, that would protect us from any infection are our skin, no? And of course, hairs that are present sa skin natin. That would prevent us from acquiring infection. And of course, innate. Ano yung nasa immune system natin? That would be your T cells, B cells, and of course, the WBC that is found in our blood. Okay? WBC. And what is that acquired, no, immune system that we have? Those immunoglobulins that we acquire, like for example, when baby pa tayo through breast milk, may IgG na tayo nakuha doon. Okay? Yung mga immunoglobulins na na-acquire natin from sources, other sources. Like for example also, ang iyong, when you have already built an antibody towards any infection through our immunizations also. Okay? Yeah. And how does HIV interrupt the normal functioning of the immune system? So, in the picture is the HIV-infected T cells. Okay. So, we go now to the phases of HIV. First phase is your infection period. Time when you acquired HIV. The window period. The seroconversion. The asymptomatic period. And the HIV/AIDS related illness. And of course, the last one would be AIDS itself. So hanggang ano lang po tayo, number 5. I think nobody died of AIDS alone, but with its complications. All right? Yeah. So let's go first to the CD4 counts. This is the number of CD4 cells in the blood, provides a measure of the immune system damage. Okay? Your CD4 count reflects the phase of the disease. So CD4 count, 500 to 1,200 would be considered as normal. But if your CD4 count is 200 to 500, then you will experience the beginning of HIV illness. Kasi mababa na po yung CD4 counts. And then, below 200, you already have the disease itself, which is AIDS. Alright? Okay. So, CD4 po ang binibilang natin. Let's go now to the window. This is the time between infection and enough antibodies that the person has. Okay. Ang duration niya, approximately 3 months. No symptoms or signs of illness can be manifested by a client. Right? An HIV test is negative at this moment. Okay? Then, of course, the virus is multiplying rapidly. So, the viral load here is very high. So, infectious po ang person if with contact with other person. Alright? Next, person is very infectious. So, seroconversion phase tayo. So, this is the point that HIV test becomes positive. Right? The body starts making antibodies to HIV a few weeks after infection. Then HIV test becomes positive. Then the person may have a mild flu-like symptoms lasting a week or two. So dito ka na magtataka ngayon. Flu-like symptoms siya pero matagal. Kasi kung may flu tayo, ininuman natin yan ng bioflu or gitreat natin ang symptoms, we will be okay on the third day. But with HIV infection, it would last a week or two. Okay? So this is already a sign. Then afterwards, after that one, the person is well again. That is why I'm telling you, you can never tell if the person has HIV or not. Okay? So careful na tayo. Symptomatic period. This is the time period between the seroconversion and onset of HIV/AIDS related illness. Okay. Duration is very variable. It can be less than a year to more than 15 years. No? Asymptomatic ka pa. Alright. So, tawag dyan, ang mga manifestations po niyan, maglabas if your CD4 count is very low already. Alright? Kasi I have a question here. Maglabas mo daw kaagad ang symptoms? Not yet. Kasi your body has normal CD4 counts. Once it lowers down, no, your body would manifest symptoms. Just like what I have mentioned a while ago, no? Flu-like symptoms po siya. Okay, flu-like symptoms that would last a week or two. Kasi normal flu kasi guys, would only last 3 days. Ang iba nga nilagnat ngayon, pagkabukas, well na. But unfortunately, with HIV/AIDS, it would last a week or two. So dito sa period na asymptomatic, no? Ang duration niya variable. It can be less than 1 year to more than 15 years. Bakit siya more than 15 years? Matagal po mamatay ang tao na infected with HIV. It so happened, there are medications that can alter or hasten, no, ang mga symptoms ng HIV/AIDS. Or hindi nila pinapababa din. Yung mga antiretroviral drugs natin po, yun ang binibigay ng ating government. Okay? So, if you submit yourself for a checkup, kasi you feel like, yung parang pakiramdam mo may sakit ka, and then you are having sex with just anyone, if you kanang wala kay labot, basta one night stand, mga ingana. Na it so happen na one of those partners has HIV. So, if ever that particular partner has HIV, then you submit for yourself for a checkup. Remember, confidential po ang mga person na HIV positive. Hindi po ginadivulge yan sa public. So, only the government knows kung sino yung mga HIV positive. Alright? Yan. Kung saan ang hospital, yun lang yung may record ka nun. And it remains confidential. Okay? So, dito, tingnan nyo. Most people remain healthy. Asymptomatic po yan for about 3 years. Okay? Yan. Then, duration may depend on socio-economic factors. So, dito na papasok po. Kung tatagal ka ba o hindi. If you are infected with HIV/AIDS. Depende na yan sa iyong stand or sa iyong position in the economic zone. Okay? Kung low o nasa poor ka, mapapadali talaga ang buhay mo. Kasi wala kang sustenance. Wala kang gamot na wala kang pera na pambili ng gamot mo. Okay? Lalo na pag meron kang symptoms with related illness. No? HIV/AIDS related illness such as nagkaroon ka ngayon, your lungs is being infected with kanang nagbaba ang imong immune system, then your lungs is compromised. Then you have to treat the symptoms pertaining to the respiratory system. Okay, in that manner, it could be treated. Then, continue ko na naman ng antiretroviral drug. Kasi in taking antiretroviral drug, it's just taking a chemotherapeutic agent lang. Okay? Ana. So, yan. The CD4 count is above 500 cells per ml. That is why sometimes in the asymptomatic period, okay pa. Bumabalik pa ang tao sa normal, kumbaga. Para kumbaga, ay, salamat, magaling na ako. Ganyan ang feeling mo. Hindi mo pa alam nga iyan na ikaw ay HIV/AIDS. Usually kasi na-detect na positive ka sa HIV too late na. No? Hindi ka nakatake agad ng antiretroviral drug. Okay? So, dito naman sa phase ng HIV/AIDS related illness, the time period between onset of illness and diagnosis of age. Duration is variable. Average about 5 years po ang tagal. Okay, illnesses initially mild, gradual increase in frequency and severity. Okay, CD4 count naman dito is between 500 and 200 cells per ml. So dito nagkakaroon ka na ng mga other forms of illnesses like pneumocystis carinei pneumonia, or your Kaposi sarcoma, which is skin cancer. Nagtataka ka, meron ka ng mga rashes, then hindi siya ma-heal, no? At saka, kumbaga, ang respiratory system mo, para kang na-drown or very congested ka, no? Sometimes, ang iba nagkakaroon ng cerebral edema until such time that they would experience coma, and then that would be their end, kumbaga. No? Mga ganyan na mga situation. Depende kung saan yung affected area mo talaga. Yung very weak area mo. Okay? Ang pinaka-common po niyan is respiratory illness. Yung pneumonia po. Yun yung nakakamatay talaga sa patient with AIDS. Alright? Next would be your AIDS percent. The last stage or the last phase, the final phase of HIV/AIDS. Duration ito without antiretroviral drugs, less than 2 years with antiretroviral drugs, potentially many years to come. So ito yung sinasabi ko na drug na if taken by the patient, you can lengthen your life, no? Kumbaga, hindi naman, Diyos ko, mga pusa talaga, oo, nag-aaway na. Okay? So, yan. Ang CD4 count mo is below 200 cells. So, you are really prone to opportunistic infections at this moment. So, anytime, pwede mo yun makuha and it can cause your death. Alright? Ganyan. Viral loads are high and the person is very infectious at this particular stage. It is very important to know that any phase of HIV/AIDS, person here is infectious. Pag ikaw i-carrier ka na ng HIV virus, you are really infectious. So by the time that you have a contact with another person, that the virus will be with that particular person. And it is up to her or his immune system on the paano ang AIDS or mapapabilis ba ang depende sa lifestyle and situation in life, no? Itong AIDS. And always remember also na wala pa po itong cure ang AIDS. Hindi po naku-cure ang person with HIV/AIDS ng antiretroviral drugs. Gina-prolong lang natin po yung life niya para at least man lang makapagbago. O di ba? No? Important facts. Okay. Duration of different phases of HIV/AIDS will vary in different people. Ito yung ibig sabihin kanina. Factors affecting the course of HIV/AIDS include nutrition, emotional stress, and access to healthcare. Itong HIV/AIDS kasi guys, para din itong cancer. Kung under stress ka, lalong bumababa ang immune system mo. So, lalong kakainin ni HIV virus ang iyong mga CD4 cells. Kaya bumababa siya. Then, of course, if the nutrition is not prohibited, kung walang limit naman, kumain ka ng right diet. No? Para naman, hindi magbaba yung stamina mo. Kasi pag bumaba yung stamina mo, mugara si virus. Matatalo ka talaga. Okay? Just like your dengue hemorrhagic fever. No? Dapat kumain ang patient. Or else, magbaba yung stamina niya. Talo na siya. Okay? Ganyan. Okay? Then, okay, naka-red po siya. People infected with HIV can infect others at any phase of the disease. So, daw tayo. Pag hindi natin kilala, wag na lang. Okay? Abstinence is the key. No? Pag ganun. Alright? Okay. Mother to child transmission. So, ito siya, controversial masyado itong HIV when it comes to pregnancy. So 25 to 30% of HIV positive pregnant mothers will pass HIV to their newborns. Ang HIV virus po mapapass on sa newborns. No, about 25 to 35%. 30% of transmission sa utero, 70% of transmission during the delivery. Kasi ma-open na, makakat na. Kung cesarean delivery naman, of course, we take universal precaution in dealing with patients with this kind of ailment. Okay? Na-open po ang nakakat ang mga blood vessel natin. So there is a probability of transmission talaga. Portal of entry sa baby, eyes, nose, mouth, no? Ears, yan. No? Kaya siya 70% of transmission during the delivery. 14% transmission with breastfeeding. Kasi napapass on po ang HIV virus to breastfeeding. Okay. Kaya sometimes guys, no, kaya nag-uumpisa talaga at nagsispread talaga ang HIV doon sa African countries because they are considered as third world. They cannot afford milk, no? Bottled milk ba? Yung in-can milk. So they opt for breastfeeding. If the mother is HIV positive, most probably, no? More than 6 months. Kasi allowed man yung mother kung gusto talaga niya mag-breastfeed. 6 months. Pwedeng ibigay. Kasi doon pa, ang mostly of the, uh, anong tawag mo niyan? Immunoglobulins are passed on within 6 months. Alright? Nakukuha na yan ni baby. Kaya, ina-allow po ng DOH to an HIV positive mom na mag-breastfeed for 6 months only. Then, advise sila, after 6 months, advise sila to have milk feeding na. Okay? Yan. Okay, sa Africa talaga, it has been found out, no? Itong aking ditong nabasa, no, na 1998 pa. Okay, 1998, 10% of all new HIV infections were in children. So almost all mother-to-child transmissions, no, were in Africa. So until now, mampud siguro guys, no? Kaya alangan mo palit sila gatas, guys, na libre naman ang gatas sa tutoy sa mama. Di ba? So, yun ang kanila. So, nagbe-breastfeed talaga sila. Okay. So, interventions to reduce mother-to-child transmission. So, of course, HIV testing in pregnancy so that we will know what to do when we handle pregnant mom. Then, antenatal care, of course, is being initiated. Okay. So, itong antenatal care, pag nalaman na HIV positive si mama, nabibigyan kaagad sila ng antiretroviral agents, no, para ma-reduce ang transmission ng HIV sa baby. Kaya nga, next to antenatal care is antiretroviral agents. So, obstetric interventions. So, wala po tayong mga invasive procedure. Wala po tayong amniotomy. Wala po tayong mga delivery via instrumentation or even get blood samples sa scalp ni baby. Wala yan. And of course, hindi po tayo nanghihiwa ng mother or we restrict surgical incision of the perineum to facilitate the head, delivery of the head. It's a no-no. Okay? Then elective cesarean section po ang kailangan gawin pag HIV positive po si ma'am. Okay? Remember, infection prevention practices. Of course, universal precaution po tayo, goggles, gown, ang gloves nito until the elbow po. Meron pong gloves na ang kanyang length until the elbow. Then newborn feeding tayo, breast milk versus formula talaga yan. Okay? Ay, samok, manairing. Okay. Yun ang sinasabi ko kanina, guys, DOH allows mother to breast milk until 6 months. Okay? After that one, wala na po. Okay. So, next would be, uy, alas 7. Antenatal care. Watch for signs and symptoms of AIDS and pregnancy-related complications. Sus, may HIV positive pa siya, may GDM, may PIH. Ay, Diyos ko, very complicated na. So, the mother is placed in a very high-risk position, no? Then, unless complication develops, no need to increase the number of visits. Okay? So, yan. Pag ang HIV/AIDS mother, inaano talaga yan, confidentiality talaga yan. So, no need na siya sige balik-balik sa pagpa-check up, no? Unless na meron siya nararamdaman na kakaiba. So, that would be the time na kailangan na i-ano ang mother. Treat sexually transmitted diseases and other co-infections if possible para yung AIDS lang po yung concentration natin or HIV, no? So, kailangan i-treat lahat. Kung si mama meron urinary tract infection, treat urinary tract infection. Para hindi po magkasabay-sabay po yung mga gamot na iniinom ni mama. Which is very not allowed during pregnancy. Counsel against unprotected intercourse. Buntis na nga, no? Mag-sex pa. So, the husband and the wife is going to be educated when it comes to HIV infection. Avoid invasive procedures. And external cephalic version. Itong external cephalic version, guys, ito yung pinoposition externally yung baby na suhi. Kumbaga. Okay? So, bawal po yan. That is manipulation po. Kaya, gina-prevent po yan. Then, give antiretroviral agents. And then, counsel about nutrition. Because nutrition is very important, no? Kasi ayaw natin magkaroon ng anemia yung patient natin. So, kasi good nutrition is very important. Anemia is an independent predictor of progression and death in HIV-infected individuals. So, yan. Okay. Next would be your antiretroviral agents. So these are the antiretroviral agents. Okay, first is your zidovudine. Pag long course ang gagamitin, 14 weeks gestation siya, oral. O, binibigyan ng oral, zidovudine yung mother. Then, intravenous during labor. Kasi meron pong IV yung mama, so pinapapadaan po sa IV. So, at 14 weeks, oral siya. Then, during labor. At the same time, ang newborn natin, non-breastfed for 6 weeks po. Okay? Until such time that it is no longer allowed. Okay? Short course naman, 300 milligrams twice a day from 36 weeks and every 3 hours from onset of labor until delivery. Ganon magbigay ng zidovudine or yung antiretroviral drug natin. Okay? Sa pregnancy ito, guys, ha? Then, nevirapine. Sa mother, we give 200 milligrams at onset of labor. That's it. Then, newborn naman, 2 milligrams per kilograms, 48 to 72 hours after delivery. And that would minimize the HIV load sa katawan ng baby. Meron din tayong combination ng zidovudine and lamivudine. No? This is your ZDV bar 3PC. Okay? So this is given 36 weeks onset of labor and 1 week postpartum. And of course, ang newborn din binibigyan. Okay? So yan. So merong mga percentages na mahihinder po ang transmission niya. So 50% po dito sa combination po ng ZDV and lamivudine. And of course, ang ating nevirapine naman, no, 47% po. At least guys, no, meron namang konting pag-asa, no, na pwedeng matransmit or hindi matransmit. Basta makastart lang talaga upon the diagnosis that the mother is HIV positive, mabigyan ka agad ng antiretroviral drug. Alright? So, obstetric procedures to be avoided. Of course, your amniotomy, yung rupturing of the membrane, yung fetal scalp electrode sampling, dapat hindi po yan. Okay, then delivery via instrumentation such as your forceps, vacuum is also prohibited. And of course, episiotomy is a surgical incision of the perineum and vaginal tears. No? Kasi ito sila ng mga procedure can cause bleeding. Okay, so yun ang iniiwasan natin for the mother or the baby be exposed to the blood of the mom. No, lalo na pag delivery. Okay? Okay, intrapartum management. So goal is to minimize duration of labor, do not rupture the membranes, avoid invasive monitoring, avoid episiotomy or instrumental delivery when possible. So delivery method of delivery, cesarean versus vaginal birth. So cesarean section before labor or rupture of members reduces risk of mother-to-child transmission by 50 to 80%. So malaki-laki din ang chance, guys. Cesarean section, however, increases morbidity and possible mortality to the mother. Then give antibiotic prophylaxis for cesarean section in HIV-infected women. Almost always man, if the person, even if hindi pregnant mo, if they would undergo surgery or invasive procedure, they are really given antibiotic prophylaxis. Okay? Para naman, if ever there will be opportunistic infection, it will be hindered. No? So, recommended infection prevention practices. Sa mga needles, take care, minimal use, only for medication purposes yan. Like what I have mentioned a while ago, no? Through IV, kailangan natin ng needle. Suturing, use appropriate needle and holder kasi baka ma-prick ka, so na mahawa ka. Care with recapping and disposal. We are no longer recapping our needle, diretso na po siya sa sharps. Wear gloves, wash hands with soap immediately after contact with blood and body fluids. Just make sure make sure lang po talaga natin, guys, na wala po mga sugat-sugat yung mga kamay natin wherein the blood can get through that one. Remember, ballpoint lang po ang kalaki ng HIV/AIDS. O, HIV virus, I mean. Then, cover incisions with watertight dressing for first 24 hours. So, dapat walang makasip out na any bodily secretions or blood, no? Sa mga dressings or incisions. All right. So, plastic aprons for delivery. Kasi kung cloth yan, ma-absorb man yan, so we can get infected. We can wear goggles and gloves for delivery and surgery. And sometimes because of increase in the blood pressure, it can spurt. Blood can spurt upon the incision, lalo na pag surgery. So, kailangan protected yung eyes natin. Kaya once napis ka ng ato ang mata, it can get in our system. Then, long gloves for placenta removal. Yan yung sinasabi ko, guys, na ang gloves ng mga doctor dito hanggang elbow. Alright? Dispose of blood, placenta, and waste safely. We should always protect ourselves. Or else, if we get sick, nobody would take good care of other patients. Okay? Universal protection talaga, guys, to protect yourself is very important. Right? Next, ang newborn. Anong gawin natin sa newborn? We wash the newborn after birth, especially the face. We avoid hypothermia just like with normal babies, no? I-prevent natin ang baby with HIV from hypothermia episodes. Give antiretroviral agents if available or as ordered by the pediatrician. Okay? To minimize or limit the viral load. Breastfeeding issues, warmth for newborn, nutrition for newborn. Yes, it is allowed already. Sabi ko kanina, 6 months. Alright, protection against other infections, particularly before we instruct the mother to perform breastfeeding, the mother should always do breast care. Safety, unclean water, diarrheal diseases. If the mother is using now milk products, no, make sure not to instruct them to sterilize the water to prevent any diarrheal diseases. Risk of HIV transmission. Yes. Then contraception for the mother para ang mother hindi ma-pregnant again. It is because, no, HIV positive magud siya. So the next pregnancy will be compromised. So magiging HIV positive. And of course, ang cost. That is why in African countries, guys, they cannot afford to buy milk. Okay? That is why they would really sacrifice na mag-breastfeeding din sila, even though they are diagnosed to be HIV positive. Okay? So, recommendations. I would just like to finish lang HIV, guys, ha? Recommendations natin. Promote exclusive breastfeeding for 6 months. counsel on the safe and appropriate use of formula. HIV positive and chooses to breastfeed, promote exclusive breastfeeding for 6 months only. Right? Okay. So that ends our topic for HIV. Okay. Any questions so far?
None, ma'am.
None po, ma'am.
None, ma'am.
Nakamute ka po, ma'am.
Ma'am, nakamute po, ma'am.
Ma'am, nakamute ka po, ma'am.
Ay, Ginoo, nagsingin ako yaw-yaw. Mali. Hay, nako Lord.
Pero natapos mo po yung HIV, ma'am.
Ay, thank you. All right. Abi na ako nakamute ko all throughout. Sakit na raw akong tilaok no? Okay. So, Mr. Casal, can you please lead us in prayer?
Okay po, ma'am. Pagkakatalig, in the name of the Father, and of the Son, and of the Holy Spirit.